Hi Tim, thanks for coming in today. My name is Megan and I'll be doing your dental hygiene therapy today.
Hello, Megan. Nice to meet you.
Nice to meet you as well. So can you tell me about the last time you went to see the dentist?
Well, it was probably 15 years ago or more in China. I had pain in my last tooth and they fixed it. I don't think they cleaned it though.
Okay, so it sounds as though it's been quite some time since you've received oral hygiene care. Do you have any concerns with your oral health right now?
Well, I think they could be whiter. They look very brown.
Thanks for sharing that with me. This is definitely something we can address today. I'm just going to complete all your assessments and we can make a treatment plan from there. Thank you for your patience during those assessments. So I see on your medical history that you smoke about a pack a day. May I ask you more about your smoking and what effects you think it has on your mouth?
Well, I have been smoking, I think, since I was 13. And I know they're the reason. I know that that's what making my teeth all brown.
Yes, what you were seeing is called tobacco staining. It is a negative oral effect of smoking. However, there are other reasons that smoking is bad for you. Are you aware of any of these other effects?
Well, I do see on cigarette packet that it causes cancer, but I think it only causes cancer in lung. Yes?
It is true that smoking can cause cancer in your lungs, but smoking is also the leading cause of oral cancer too. Have you tried quitting in the past? And if so, can you share that experience with me?
Yes, I tried quitting before. It's very, very hard. And I never got pain, so if it's not hurting, then why should I quit? It's been a very hard year coming to Canada. I don't have time. I am stressed, finding job, keeping kids happy. My wife had no job. She take care of kids, and I need to work for money.
Thank you for sharing that with me. I appreciate that this must be a very difficult transition for you and your family.
Yes, it's been very hard. Getting family settled is my first priority right now.
Absolutely. I'm hearing you are very dedicated to your family. Does your wife have any concerns with regards to your use of tobacco, or does she also use tobacco?
No, my wife don't use smoke. I do smoke in my house and my wife says it's not nice. She wants me to quit. She is worried about the kids picking up my habit. I don't want them to pick up my habit. They copy me sometimes, but I never let them close to the cigarettes. I know it's very bad. I like cigarettes just because they relax me after a long day of working.
Okay, so I'm understanding that you want to set a good example for your children at home, and you like smoking because of how it makes you feel.
Yes, my kids are the reason I moved to Canada. I want them to have better future. I don't want them to get my habits. I know it is bad to smoke around them. They shouldn't be breathing my smoke. But I just don't know about quitting right now.
So it must be exciting to think about all the opportunities your kids will have here in Canada. May I ask how important it is for you to set a good example for your kids regarding their oral health?
It is very important. I don't want them to have brown teeth like me. People look at me funny sometimes because of the way my teeth look. And I don't want my kids to feel that way too. In Canada, people don't seem to like smoking. And I don't like to think that jobs will not be open to them because they smoke.
It's great that you want to set a good example for your kids. But now, may I ask how important, on a scale of 1 to 10, how important it is for you to keep your teeth right now? 10 being most important, and 1 being not important at all.
Hmm. Well, it's very important. So I think around an 8.
Great. So I'm hearing that you do recognize the importance of keeping your teeth, but what makes you say an 8 rather than a 0?
Well, I need to eat. I like my food. I know my parents had plastic teeth when I was young, and I thought they looked really strange. I didn't ever want to get those teeth. If my teeth fall out, I would never get those plastic ones. So I think I don't have a choice but to keep these ones in.
That's excellent, Tim. I can see that you're really passionate about preventing your tooth loss.
Yes, I want to keep them. Can you say what smoking is doing in my mouth?
Absolutely. Let's pull up the assessments that we completed earlier and take a look at them together.
Okay.
So Tim, as we can see here on your radiographs, there is some bone loss. Do you know what periodontitis is?
No.
No. Do you see any problem here?
I don't see the problem.
Okay, so there is little spaces in between your teeth, which is bone loss.
I don't understand.
So we'll take a different look, a different approach using this picture.
Okay.
So this is the side of a healthy mouth, and this is what periodontitis would look like in your mouth. So it's the destruction of the supporting structures around your teeth. It has bone loss, which means your tooth is going to become more loose.
Okay, I see. I see bone here.
Mm-hmm.
Smaller here.
Yes.
Okay.
Exactly.
Oh, that seems very serious. I don't want to lose my teeth and pay money for fake teeth.
Yes. Unfortunately, this periodontitis is irreversible. However, there are some preventative things we can do. I would like to refer you to a periodontist who is a dental specialist for consults. Does that sound okay to you?
Yes, I can make an appointment and see what he says. Hopefully he can keep my teeth hanging in there.
Great! I recommend that you also come see us every 3 months because it is very important to keep things clean and prevent further loss. Also, did you know that tobacco is the leading cause of gum disease?
No, I did not know.
Yes, and the prevalence and severity of oral disease, such as periodontitis, decreases with quitting smoking. So, knowing all of this, on a scale of 1 to 10, how ready do you feel to quit smoking? 10 being I'm 100% ready, 1 being I'm not even thinking about it.
I think I will be a 6. I know if I stop, I will have whiter teeth, save money, better health, but I am addicted. I cannot deal with the stress. I feel like a different person. It is very hard. But I know I will smell better, and my kids will not complain.
So by the pros that you have listed, it seems as though you are already thinking about quitting. Yes, you will definitely save money, as well as enjoy many other oral health benefits, including whiter teeth.
Okay, yeah, that sounds good. When I came in, I was a 2. Now you convinced me, and I'm ready and try to quit.
That is wonderful to hear. I advise that you quit smoking because I think you really can do it. May I share information about other resources for quitting with you?
I think too. I think I can quit. But please, I need help with my cravings.
Tim, I recommend that you be in partnership with your doctor for advice on help with the cravings, such as nicotine withdrawal. I can also suggest the Alberta Quits Helpline, which is a toll-free service that is available 24/7, and it is also offered in 180 languages. I'll give you this brochure, which has the number in it.
Mm-hmm.
Tim, I want you to know that I really appreciate everything you've shared with me today. The next step is ultimately up to you, and I'm here to help you along the way. Next appointment, we will follow up on your consult with the periodontist.
Okay, sounds good. I see you after appointment. Okay, thank you.
Thanks for coming in.
Yeah, you're welcome.